Can cherries genuinely help improve a fatty liver condition? Have you heard that cherries might be good for fatty liver disease? Let's look at what the evidence actually says. Fatty liver disease affects around 1 in 3 adults in the UK. That's a significant number of people, and diet plays a central role in managing it. Fatty liver disease, or hepatic steatosis, happens when excess fat builds up in liver cells. There are 2 main forms. Non-alcoholic fatty liver disease, known as NAFLD, affects people who drink little or no alcohol, and it's often linked to obesity, type 2 diabetes, and metabolic syndrome. The other form is alcohol-related liver disease caused by excessive alcohol consumption. It's worth knowing that NAFLD can be present even when liver blood tests come back normal, so a normal result doesn't necessarily rule out the condition. Now, where do cherries come in? Cherries contain compounds called anthocyanins and polyphenols, which have antioxidant properties. That sounds promising, and some animal studies do suggest potential benefits for liver health. But, and this is important, those studies used concentrated extracts at doses far higher than anything you'd get from eating whole cherries as part of your normal diet. Concentrated extracts and supplements are not the same as eating whole fruit, and they aren't recommended for treating fatty liver without guidance from your healthcare professional. There are currently no high-quality human trials that have directly looked at cherry consumption and NAFLD outcomes. So whilst cherries are a nutritious fruit, the clinical evidence linking them specifically to improvements in fatty liver disease in humans simply hasn't been established yet. That said, whole cherries can be included as part of a balanced, liver-friendly diet in moderation. If you're thinking about cherries, opt for whole fresh or frozen fruit rather than juices or sweetened products, which can be high in free sugars and may actually work against liver health. The dietary approach with the strongest evidence base for managing NAFLD is the Mediterranean-style diet. Plenty of vegetables, whole grains, legumes, fish, and healthy fats, like olive oil with limited processed foods, added sugars, and saturated fats. NICE guidance is clear that the focus for managing fatty liver disease should be on overall lifestyle modification, gradual weight loss, reduced calorie intake, and improved dietary quality as a whole, rather than on any single food or ingredient. So if you're looking at your diet to support your liver health, the conversation to have with your doctor or a registered dietitian is about your overall eating pattern. Ask about a Mediterranean-style approach, how to reduce ultra-processed foods, and what gradual sustainable changes might look like for you specifically. Everyone's situation is different, and personalised guidance makes a real difference. On the safety side, fatty liver disease can progress silently. Many people have no symptoms in the early stages. If you've been told you have fatty liver, or if you have risk factors like obesity, type 2 diabetes, or metabolic syndrome, it's important to stay in regular contact with your healthcare professional. If you experience symptoms like persistent fatigue, abdominal discomfort, or yellowing of the skin or eyes, seek medical advice promptly. And please, always speak to your doctor or a registered dietitian before making significant changes to your diet, especially if you have an existing health condition or take regular medication. So, to recap, cherries contain antioxidant compounds, but there isn't currently enough clinical evidence to recommend them as a treatment for fatty liver disease. Whole cherries can be part of a healthy, balanced diet, particularly a Mediterranean-style one, which does have strong evidence behind it, and dietary management works best as part of a broader lifestyle approach guided by your healthcare team. Have you made any dietary changes to support your liver health? Share your experience in the comments below. We'd love to hear from you. And if you found this video helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.